So on that note, let's dive into our segments. I think what I want to talk about is basically our self-hating government, basically what we've been talking about already. So, as we all know, Republican politicians and, of course, many of their Democratic colleagues are trying to dismantle the social safety net at pretty much any given time. So you'll typically see this in the form of tax breaks for the wealthy, rampant privatization of goods and services, and endless budget cuts that starve schools and public programs of funding. However, another way that policymakers famously and deliberately undermine government aid is through excessive red tape. So this is what the policy scholars Pamela and Donald Moynihan call administrative burdens. And an administrative burden is basically anything that makes a service harder for people to access, or any kind of hoop that people have to jump through before they can get benefits. So, for example, if you need food stamps, but you have to fill out tons of forms about your income and whether you receive child support before you can qualify, that's an administrative burden. Likewise, if you are trying to apply for unemployment insurance and you have to go through a half-broken website that keeps crashing and looks like it was made in GeoCities in 1992, and then you have to spend hours on the phone on hold before you can talk to a person, that's also an administrative burden. And I think what's important to know about these types of, excessive red tape measures is that it's not just that the government is like shitty at making websites, or, they're incredibly inefficient, or they don't know how to run programs. Rather, what's going on is that making people jump through tons of hoops for benefits is actually another way for lawmakers to deliberately undermine public programs. So I want to look at one example in particular, because this has been in the news again. Earlier this week, the Biden administration asked the Supreme Court to toss out an upcoming case regarding Medicaid work requirements. So to understand this case, we have to go back to 2018, which is when Arkansas became the first state to institute work requirements for Medicaid recipients. So what that meant is, in order to remain eligible for benefits, people on Medicaid in Arkansas had to submit paperwork proving that they were working or in job training or volunteering for at least 20 hours a week, or they had to file for an exemption showing that they were disabled. So, unsurprisingly, the rollout of this new requirement was a complete disaster for Medicaid recipients. Many beneficiaries were just not notified about the new paperwork that they were supposed to file. Others were trapped in this insane nightmare of trying to comply with an incredibly confusing and poorly functioning system. So let's take a look at this clip from PBS.
Adrian McGonigal's life is coming undone.
Never wanted me to stay longer, but
in the past few weeks, he's lost his job, his health insurance, even his feelings of self-worth.
Without my medication, I can't really sleep good, so.
He's worked all his life, but now, at the age of 40, he's entirely dependent on people like his mom to get by. And he blames the U.S. Department of Health and Human Services.
Your status as far as
The Arkansas Works is concerned.
This summer, he had a decent-paying job at a chicken plant outside Bentonville. But when the Trump administration allowed the state of Arkansas to impose new work requirements on Medicaid, he, like many Medicaid recipients, got confused about how to report his hours.
I thought that everything was good about this. I thought it was just a one-time deal that you reported and then that was it.
He was wrong. He was supposed to log those hours online every month. He became one of the 12,000 people that the state has booted from the Medicaid rolls in the last 3 months.
How do I get my insurance back on?
He discovered this only when he went to fill prescriptions at this drugstore, and the pharmacist told him, sorry, your coverage has been canceled.
And that it was going to be like $340 for one of the medications and like $80 for the other one.
So he left empty-handed. This was a big deal because McGonigal has severe COPD, a chronic lung disease that makes it difficult to breathe. Without his meds, he landed in the hospital multiple times and missed a lot of work. His supervisor tried to accommodate him, but he wasn't healthy enough to perform his job, so he lost it. He's now part of a lawsuit against the federal government, charging that his story is a cautionary tale. His lawyers say it proves why adding work requirements to a health insurance program can backfire and actually make it harder for the poor to hold down a job.
So unfortunately, Adrian was not the only one who experienced dire consequences. As a result of these incredibly burdensome and punitive work requirements, more than 18,000 people in Arkansas lost their Medicaid coverage in 2018. Now, of the Arkansas residents who lost Medicaid, 50% reported serious problems paying off medical debt, 56% delayed medical care because of the cost, and 64% delayed taking medications because of the cost. So, in addition to this hardship on Arkansas residents, we also now have several studies on the implementation of the work requirements that have basically proven that they produced no significant increases in employment in the state of Arkansas. So, does that mean that this initiative was a failure? Actually, quite the opposite, because the work requirements were never really supposed to increase employment or really even reduce Medicaid fraud. This was simply a way to kick people off of Medicaid with the ultimate goal of shrinking the program. So, to go back a little bit, at the beginning of 2018, when Arkansas's state legislature was debating whether or not to reauthorize the state's Medicaid expansion under the Affordable Care Act, Republican lawmakers forced the addition of work requirements in exchange for their support of the reauthorization. This is what one state senator had to say about the addition of work requirements to Medicaid. "It certainly makes it more palatable," said Republican Senator Alan Clark, an opponent of the expansion, who said he was undecided on whether to support the budget measure. "Still, overall, I'm not a fan of the program." So, what we really see here is that when politicians want to gut a program, but they know they could face political repercussions for doing so, sometimes it's just easier for them to strangle the program in red tape, right? And I do want to mention here that in 2019, a federal court did put a hold on Arkansas's Medicaid work requirement, which is why the case is now before the Supreme Court. And hopefully the Biden administration will be successful in getting it tossed out, which will mean that Medicaid in Arkansas will remain free of work requirements. But of course, this will not undo the significant hardship that Arkansas Medicaid recipients experienced in 2018. And just to, really drive home the fact that instituting excessive administrative burdens is a deliberate policy choice that's meant to undermine public services, I now want to look at a different example that shows that when the government wants to do this, it can actually shift the burden onto itself and away from its citizens. So, there's one public program in the US that almost everybody will use. Almost everybody likes this program. And at this point, most politicians are afraid to openly attack it. That's, of course, Social Security. And one reason why this program is so durable is because during the New Deal, policymakers explicitly designed the program to minimize administrative burdens and red tape. So, the Social Security Administration famously keeps track of your earnings for you. They automatically calculate your benefits and your eligibility. And basically, as soon as you turn 67 and it's time to start collecting your benefits, all you have to do is enroll on the SSA website or show up at a local field office. I think there's something like 1,500 in the US. And we can definitely, improve Social Security even more. But overall, it's been a huge success. Today, the poverty rate among the elderly is around 9%. There are some estimates that without Social Security, close to half of all seniors would be living in poverty. And of course, it's not just the US. We can also look at how other countries have minimized administrative burdens or have found a way to put the onus back onto the state. So, for example, Taiwan, in the 1990s, they transitioned to a single-payer healthcare system. And what they did to roll it out was they sent out teams of social workers to rural and underserved areas in order to just register everybody they could find for the new system and explain its benefits. As a result, today, close to 100% of the Taiwanese population has health coverage. The public satisfaction with the healthcare system is consistently over 80%. And at the same time, Taiwan's healthcare administration costs are actually some of the lowest in the world. So I want to just end by saying, this is what government is capable of. And this is why I kind of take issue with some of the libertarian and or anarchist arguments that a Byzantine bureaucracy is just something that's inherent to a state-run program. I don't think anybody defends how awful it is to try to make people navigate systems that are, designed to block them out. But the point, again, is that we have to think of the barriers in these systems as policy choices in and of themselves. So I will wrap up there and turn it over to you, Ariella, if you have thoughts.
Yeah, I mean, you can look at Taiwan's success with COVID as proof of the way that their single payer system has worked. They have had 942 COVID cases and 9 deaths during the pandemic. And that is absolutely down to the ease and accessibility of healthcare through the single payer option.
Yeah, it's actually very interesting how COVID has just exposed every contradiction that we've been talking about so far. Again, with COVID, lots of people were trying to navigate unemployment and couldn't, because every state's, requirements and system are different. Like people experienced, websites that were down for hours, couldn't get through on the phone. I don't know if you saw that there's a Reddit forum just dedicated to navigating unemployment that has basically exploded in popularity during this time because there's just nowhere else that people can turn. Yeah. So again, it is a kind of interesting test case, I guess, a really horrible one that just shows the state that our government is in. But also, like you were saying, what other people or what other countries are doing that shows that like it can be done.
Yeah, exactly. And, the administrative burden shift is not unique just to government policies, right? This is what insurance companies do. This is what happens when you have to return your router. And they're like, no, you have to go to Governor's Island or something at 13 o'clock on a Saturday. A lot of firms use these because they don't want to be seen as not offering a service or making something difficult. And so they shift that onto the individual and they say, oh, no, you just failed to understand 35 pages of legalese to access your insurance benefit.
Right. Wait, the modem thing is really funny because I didn't even think of that, but it's totally true. I've had to do that.
I think I still have a modem to return and I'm still getting charged
for it. Yeah.
Yes. And I can't figure out how to get it back. And this is like not an accident. There are a lot of people whose job it is to force you into these little lab rat scenarios where you can never pick the right direction and never figure out your way out.
Right.
It's the same when you read credit card small print.
Oh, yeah.
Or, so many transactions in the US, including getting prescription drugs, have these kinds of things baked into them. And then the risk or the liability shifts onto the consumer. You can't sue your credit card company.
Right.
Or it's very, very difficult to actually hold these institutions accountable because they wrap themselves up in these kinds of burdens for consumers.